Good afternoon, good morning. Good morning, my hospice family. Hi. Hello, everybody. Happy New Year. Happy New Year. Welcome back to Duns Hospice. My name is Nurse Dawn. You could call me Nurse Dawn, and I shall be your hostess. Come on in, my beautiful people. Come on in. We are live, y'all. Yes. Yes, we are live. Come on in, my beautiful people. Um, I am gathering up my notes as always, as YouTube gather us up. Okay, come on in. Happy New Year, guys. Happy New Year. Let me know what your New Year resolution is. Let me know how was your New Year. Um, I pray for you guys. I pray for you, my hospice family, and I pray that you and your family had a wonderful new year, okay? And that 2026 will bring you joy and happiness and all of your heart's desires, okay? Of course, if it does not harm anybody else. Okay, guys? That is just awesome. Awesome. We are going to talk about it, my beautiful people, my beautiful hospice family. We are going to talk about, okay, why does hospice exist? Okay, we are going to talk about hospice care. We're going to talk about why it exists. Okay, so come on in, my beautiful people. I'm just waiting on YouTube to gather more people for me. Okay. I I always say to myself that I should have probably I should have put a shorts on, like, meaning like I should have put a video on right before I go live, because that would probably have the algorithm summon more people for me. Hello, my beautiful hospice family. Please say hi as you come in. Hello, cookies. Happy New Year. Happy New Year. Thank you for being here with me today. We are going to talk about why hospice exists. Hello, Mehan. Happy New Year. Home. I'm from the Northeast area. Northeast in Massachusetts. Where is home for you? Huh? Where is home for you? Happy New Year, Mehan. Yes, cookies. Thank you. What's your New Year's resolution, my hospice family? Let me know your New Year's resolution. Oh, I love the little emojis. That is so great. Mike Ox Long say, pray for me. I just got off from a knee growth surgery. Okay, yes, prayers. Prayers goes out to Mike. Okay, Michael, prayers to you, my friend. Um, Patty, happy birthday. You guys say happy birthday to Patty. Please come on in, guys. Subscribe. As you come in, I'm gonna have you subscribe, okay? Subscribe and give me a like. Thank you, cookies, for subscribing. That's awesome. I appreciate you so much. Happy birthday, Pat. Oh, Patty, Cookie just wished you a happy birthday. That is awesome. My hospice family. Come on in, guys. We are going to talk about why hospice exists. Okay, we're going to talk about why hospice exists. As we know, this channel, okay, this channel is about end of life care. I am a hospice registered nurse of over 10 years. Okay, yes, you guys are wishing each other happy birthday. I love it. Patty, if you don't mind sharing, how old are you today? It's up to you, because I know us ladies, sometimes we don't like to share our age. But yes, we are going to talk about hospice, okay, end of life care. To anybody watching right now who's a caregiver or knows somebody who's a caregiver, this channel is specially for you, my hospice family. Okay, I created this channel as a hospice nurse. I created this channel to empower people to empower us to be able to know what to do when a loved one is under hospice care. Patty, you are 10. I love it. My son is also 10 years old too. And actually, he's the one who picked out this topic, okay? This topic of why hospice exists. All right? So yes, my hospice family, definitely this channel, hold on one second. This channel is here to empower anybody. Okay, hi Finley, welcome, welcome, welcome to the family. Everybody, please subscribe if you haven't done so. This channel is for anybody who's a caregiver, okay, who's currently taking care of a loved one. Thank you, Drake. Thank you so much. Who's taking care of anybody who's under hospice care, okay? And I definitely created this channel for us so that we can come together as caregivers. If you know somebody who is suffering or who's at the end of life, okay, let them know that they don't have to suffer by themselves, okay, because we are here to help them. Thank you, Drake. You're so kind. You're so kind. Now, who knows about hospice? Like, who here can tell me about hospice care? Like, what have you heard about hospice care? What have you heard about end of life care? Now, hospice means that the doctor has told you or your loved ones that you have 6 months or less to live, and that the illness that you have, there's no cure for it, okay? Oh, thank you, Kashi Hearts. You say you look so fresh and pretty. Which foundation do I use? Oh my goodness, I cannot think of it on top of my head. Let me tell you what. Subscribe. Go ahead to my YouTube. I'm sorry. Go ahead to my Instagram page, Cash. Go to my Instagram, okay? It's DunsHospice, okay? All one word. DM me and I will send you the link of my foundation, okay? I will send you the exact foundation because right now I can't think of the name and I don't want to tell you the wrong one. So Kashi Hearts, go to my Instagram, DunsHospice, okay? Follow me on Instagram and DM me and I'll send you the exact link to my foundation, okay? All right, now that being said, hospice, guys, hospice was, let me just get my notes ready here once again. Hospice started in 1967, okay? So hospice care has been around for a long time. It started since 1967 by a lady, okay? By a lady called Dame Cicely Saunders, okay? Cicely Saunders started hospice care back in 1967, okay? So it has been there for a very, very long time. And hospice care exists, guys. Hospice care exists for many, many reasons, okay? And I'm going to help you to understand some of the reasons, you know, why hospice care exists, all right? First of all, it exists to help people to find comfort, okay? It is more for people who are dying to find comfort rather than a cure. Hospice end of life care focuses on comfort, okay? And it helps us to, as registered nurses, okay, it helps us to help you with issues like pain. If you have pain, if you have difficulty breathing, if you have nausea, vomiting, okay, things of that nature, hospice helps you with those difficulties, okay? So we focus on your symptoms, all right? Because too many times when we are dying, when we are taking care of somebody who's dying, we don't know what to do. You see, most of the doctors out there, they are not trained to help people who are dying. They are trained to help people, you know, who is pretty much wants to get back to, you know, their regular lifestyle, okay? But what happens when your illness, okay, say you have cancer, All right, guys. Say you have cancer or you have, kidney disease. What happens when the illness you have, the doctors say to you, there is no cure for it. You see, the doctors say to you that the best thing to do is to go home and be comfortable. You as the husband, say if it's your wife who's dying, or you as the wife, say if it's your husband who's dying, or your mom, your dad, you as a caregiver, what do you do? What do you do when you are taking care of somebody who's dying? And so this is basically what this channel is for. It helps us out there as caregivers. It empowers you, okay? I want to empower us. I want to give us knowledge so that we can make the best educated decision for our family. Okay, guys? So yes, so number one, the reason why hospice exists, the number one reason is so that we can help to manage your symptoms. Okay? All right. Now, the second reason why, and I just have 5 reasons, okay? I just have 5 reasons as to why hospice exists, okay? The second reason, guys, it is to honor you as the person rather than to focus on the disease. Okay, now what do you mean by that, Nurse Dawn? Nurse Dawn, what do you mean by that? Well, what I mean by is we help to make your wishes come true. Okay, we help to make your wishes at end of life. Thank you for the hearts, guys. Thank you for the hearts. We help to make your wishes at end of life come true, whether it is to attend your daughter's wedding. Okay, because some people, all right, some people are in so much pain that they cannot get out of bed. So we as the hospice nurse, we can come into your world, we can come into your home and help to manage your pain so that you can be able to be comfortable enough to walk your daughter down the aisle if she's getting married, okay? We can also help to honor your wishes. If you want to be a DNR, do not resuscitate, okay? We will honor that. Or if you as the caregiver and the patient, if you wish to stay home and die peacefully in your home, us as hospice nurses, us as hospice staff and hospice social workers, we can definitely honor that, you see? And so we focuses on the person and not just the disease. You see, we focuses on like the holistic point of view. All right, does that make sense, my beautiful people? My beautiful people, let me know if that makes sense for you. Okay, so hospice treats the whole human being. Okay, we treat your physical needs, your emotional needs, your spiritual needs, okay, your psychological needs. All right, we have a whole team of people such as the social worker, we have the spiritual care coordinator, like a pastor or priest who comes into your home and honor your wishes. All right, okay, guys, any questions about that, my beautiful people? Let me know, please. Let me know. Thank you, Cookies. You are so nice. Thank you so much. Okay, so number 3. Okay, number 3, the third thing is that, hold on, guys. The third thing is that the reason why hospice exists, and I kind of touch base upon that too. Hospice helps people to die safely wherever they wish. No longer you have to go to a hospital, okay? Back in the days, before hospice came around, if you were not feeling well, okay, if you had a terminal illness, you had to go to the hospital, most likely. So now you could stay home and die in the comfort of your home, of your bedroom, surrounded by your loved ones. So no longer you have to go out to the hospital, okay, and deal with a cold room surrounded by strangers, with a bunch of noises, call lights, and all these distractions, okay? So you get to choose where you want to take your final breath And that is very important. That is very, a lot of us, okay, we want our last breath to be in a familiar place, in a familiar area, surrounded by our loved ones, right? Absolutely. Absolutely. So that's another, so that's the third reason why hospice exists, okay? So once again, the number one reason I had mentioned, okay, so like I said, I just have 5 reasons by hospice family. And of course, let me know if you have any questions about hospice, about end of life care, death and dying, okay? The number one thing is that we focus on comfort, we focus on your symptoms. Number two is that we honor you as the person, not just the illness, not just the disease. We honor everybody, like every part of you, okay? The third thing is that we allow you as the patient to choose where you want to die, where you want to take your final, breath. Okay. And the fourth reason why hospice exists, okay, based on my experience as a registered nurse, all right, is because we want to be here for the family. We do not abandon the family, okay? We provide family support. Okay, so it's so hard as a family, okay, as a family, to watch your loved ones dying. And I have mentioned this before, but my father, okay, my own father, is under hospice care. We had to put him under hospice care, right, because of his illness that he's currently facing. And so hospice definitely helps the family. It supports the family, especially the social worker, especially the hospice social worker guys. Oh my goodness, they are awesome. They will provide the family with emotional support. Okay. Um, Sometimes there are family dynamics, okay, where families don't get along, or families, they have conflicts of, like, how the funeral should look like, whether or not mom or dad should be on medication, what kind of medications, like. And then there's also, like, sometimes people feel guilty, people feel guilty, people feel sad. And so the hospice staff, okay, the hospice staff comes in, and we help families to navigate these emotions. You see, we help you as a family to know, what to do and what not to do, um, in situations like that, you see. So that's absolutely okay what happens. All right. And the last but not least, guys, last but not least, um, let's see. I just want to make sure that I have my notes here. Okay. All right. The last but not least, guys, and let me know if you have any questions. Please let me know if you have any questions. Okay. Hospice provides a peaceful, dignifying death. Okay. Without hospice, and I have seen it and heard it myself, without hospice care, a lot of people, okay, would die in pain, especially our patients with, cancer, okay, with cancer, with, COPD, with lung disease, all right. Um, they would they often would say to me, okay, if you wasn't here, if you weren't here, if the hospice team was not here, mom would have suffered a lot. Can you guys let me know if you guys could hear me, because I had an incoming call. I always forget to put my phone on do not disturb. So let me know. Can you guys still hear me? Let me know if you could hear me, guys. Whenever I have an incoming call, the phone just kind of like freeze. You could hear me. Thank you, Cookies. Thank you. Thank you. Okay. So yes, like I was saying, number 5 is that hospice provides your loved ones with a place to die in a dignifying manner, okay, in a dignifying way, in a peaceful way, all right, where everything just come together, okay, everything just come together as one, where there's no confusion, there's no pain, there's already a plan set up, meaning the person know if they want CPR, if they don't want CPR, they already know which funeral, okay, which funeral place they want their body to be taken to, okay. We already have the treatment plans, okay, of how to take care of them. So hospice definitely exists to ensure that your death is as gentle, as peaceful, and as meaningful as possible. Okay, my husband's family, let me know if you have any questions, because I know that hospice, end of life care, it's a very emotional topic, okay, because it is very sad. It's very emotional, very sad, and also very scary, okay. It's a very scary thing, and I completely understand this. But this channel and myself as a hospice registered nurse, I am here to hold your hands through this process. I am here. Use me as a friend. Use me as a resource. If you have any questions about death and dying and how to take care of your loved ones, I am here for you. Okay, I'm definitely here for you. And that's why I created this channel, because over the years, since 2012, I've been a hospice nurse. So over the years, I have walked into so many families' homes, and I have families have asked me so many questions, and I always thought to myself, if I was a caregiver, this is what I would want to know. If I was a caregiver, okay, this is what I would need to make my job as a caregiver of taking care of my loved ones a lot easier. And so this channel, guys, these topics that I choose to talk about, it really are topics that is dear to my heart. It's really topics that I say to myself, how can I make my supporters out there who's taking care of somebody who's dying, what do they need to know? How can I make them feel more at ease, less anxious, okay, less stress? All right. Thank you, Uncle. Oh, that's so sweet. Look at all the flowers and purple hearts. Thank you. Please be sure to subscribe, guys. Subscribe if you haven't done so. Thank you, guys. But yes, please, guys, stay connected, okay? Stay connected with me. I'm on TikTok. I'm on Instagram as DunsHospice, DUNS Hospice, all one word. Cookie give me some bunny ears. So cute. But yes, guys, reach out to me. I also have a book, okay? I have a hospice book. If you ever need to give somebody a gift, I would highly recommend check out my book on Amazon. It will be a blessing, okay? It's a good way to start to know what hospice is about, okay? All right, my husband's family. Well, I gotta get going, guys. I gotta get going. I gotta go, but I just wanted to come out here and just talk to us about hospice care, and just let you know why hospice exists. So hospice been around since the 60s, okay? That's when it started, 1967, as I mentioned earlier, okay, by our friend, our girl Cicely, okay? All right, guys, so I will see you in the next video. Make sure you subscribe, hit the notification bell so you will know each time I upload a video, okay? As always, I love you with the love of Jesus Christ. Take care of yourself and each other. Bye, guys. Thank you.